I still very much use my traditional physiotherapy skills, and so should you. I have a proposal of maybe trying something different along with your patients, along with these physical skills. And maybe some of you are using these already and you're not aware of that you're using these already. But it took me a wee while to work out what psychologically informed practice is. And my understanding of psychologically informed practice is that it's a framework that gives us as physiotherapists who are not psychologists and haven't been trained in psychology to work with, so that we can still apply our physiotherapy skills and knowledge, but at the same time focus and identify and work with the psychosocial factors of pain. And so we support people living with pain and persistent pain in a very holistic way. It's a practice that draws on and uses different psychological frameworks, such as acceptance commitment therapy, cognitive behavioural therapy, mindfulness, along with perhaps acceptance commitment therapy or its own entity, motivational interviewing, compassion focused therapy, and you'll probably find that different pain management programs use different components of these therapies to make it work for whatever it is that they are wanting to provide. And I think having a framework is really helpful, because ultimately our jobs are, we want to help people. We want to facilitate behaviour change with people. People have come to us with a problem. They're not able to do things that they want to do. So we need to help them do that so they can live the way that they want to live. And I don't think we were ever given or certainly I wasn't, when I was training, ever given a framework as to how to do that. And I don't think I was ever given a framework helping me understand why it was difficult for people to make those changes. I mean, let's face it, we all know that we want to perhaps make changes within our lives, but it is hard. So having a framework has helped me do that with people. But at the same time, I go back to the fact we're not psychologists, but we do need to understand people as human beings and not as machines. And so understand their moods, how they're feeling in general, and also their thoughts and feelings around the pain they experience to help them fully. I also appreciate that practicing psychologically might bring about concerns. You might not feel you have the skills, you might not feel you have enough time, you might not want to open a can of worms and be able to address the problems that the person has told you about. And you're right to have concerns, because you have to work within your scope of practice. But there are lots of good people, lots of people on the PPA, as well as lots of other people who are very keen to support and help you. There are loads of websites, podcasts, books, and courses that you can learn more about all these different frameworks and try something from them. It doesn't have to be adopting the whole framework, just maybe a few things to start with. I think the interesting thing is that there are underpinning themes with all these frameworks. And the sort of main themes that underpin the frameworks that stand out to me are having a good therapeutic alliance and working with people on their values and with meaningful goals. And so implementing psychologically informed treatment strategies and techniques offers the promise of improving patient care for people living with pain.